Okay, so this is just going to be a little tutorial on SICAT Air, part of the SICAT suite from Onsidexis from Sirona. And so SICAT Air will map the airway. I use this all the time. On adult patients, I'll use this for screening for sleep apnea because I'm treating sleep apnea in the office. And this x-ray, it looks like there was quite a bit of distortion, or it was taken wrong. I guess it's distortion from all of the crowns, metal crowns that are in her mouth, and it just kind of goes back into this area of the airway. And I'm going to show you what to do about that. You double click in the back part of the hard palate and then go down. I usually don't go down below the hyoid bone, but pick a reference point. It's really hard to see the spine, so we'll just go down to about here. When you double click on something that looks like this, the software has trouble in seeing where that airway is. It actually stops it here, and it shouldn't stop it until it gets down further. And so one way to just easily take care of that is just hit this add to airway button and then click down here, and then it will continue on that line. And then with that you can hit OK, and then it will map out the airway. My favorite view for this is this screen right here, and then you can export that out, and then I put this into the patient's chart and review that with them. And as you can see, this patient, they have quite a restricted airway. So here we see we've got a depth of 5 millimeters and a width of 17, and that is corresponding to this minimal cross-section area, and that's where this white line is. That is pretty small, and I think that there would be a high likelihood in this patient that they have sleep apnea. Now, I don't ever diagnose, and even after I have my patients take a sleep test, I still, even if that says that that there's sleep apnea events that are happening, I still have to take those results and send them to a sleep doctor, and they diagnose. I can't diagnose it, but this is a really good visual representation, something that the patient can see. I really like that it's color coded. They can see very clearly that this is a constricted area, and they're going to wonder immediately why their airway looks red. And then we have a conversation about sleep apnea. So if you ever run into that where it's cutting off the airway, usually it doesn't do that. If you've got a good image, it won't do that, but if you've got a distorted image like this, sometimes that can happen. You just go into that add tool and you click on where you want it to add, and it will do that. I'll be getting the Moonray 3D printer, the dental version, and so I'll be doing an unboxing and then starting to do reviews on that, including a comparison video between the Forum Labs Form 2 and then the Moonray Dental 3D printer, just to see which one I like more. But anyways, I hope you like this video, and we'll be sending you more. Thanks, guys.